Hi everyone, I'm Dr. Lisa Medaglia, also known as Dr. Lullaby. Today we're going to talk about coexisting conditions. We'll specifically review mood disorders, autism, developmental delay, and medical disorders and how they pertain to sleep. So let's first talk about mood disorders. The most common mood symptoms that I see in my clinic going along with sleep complaints are depressive symptoms and anxiety symptoms. And this makes sense because if you look at our diagnostic manual for psychiatric disorders, to diagnose depression or anxiety, the option of a symptom of sleep complaints is present. So whenever I see a patient struggling with mood symptoms, I always ask, are you working with a therapist or a psychiatrist? Because we want to make sure those symptoms are best controlled. We know that if they're not optimally controlled and you're struggling with depression or anxiety, that's going to make it really hard to see improvements or benefits from sleep. So when the mind is racing and you're feeling anxious or depressed, it's hard to fall asleep and return to sleep. And then we also know that if patients are sleep deprived, it's harder to control their thoughts and emotions, and they're more at risk for increased symptoms of depression and anxiety. So it kind of also leads to the point that it's also really important that they work on sleep. So we want to make sure that mood symptoms are managed, and we also want to make sure that sleep is managed when we see patients who have a coexisting condition in the space of mood disorders. Next, let's talk about autism. So I would say that we know from research that most children with autism struggle with sleep. And it's probably a multifactorial reason why children with autism struggle with sleep. We suspect that because they struggle with transitions during the day, kind of going from one task to another task, and we know that sleep is by nature a transition, right? You're going from a stage of wake to a stage of sleep. You're going from an activity to laying in rest. That is part of why children with autism struggle with sleep. And we also have seen in research that their sleep architecture and circadian alignment can be different. So those are factors that kind of explain the underlying reason. And I think the importance of working on sleep is very valuable in children with autism, because if we can optimize sleep and get them more hours of sleep, it can help with their focus and can thereby contribute to improving productivity in their therapy services. The next coexisting condition I would talk about is developmental delay. So we also see that most kids who have developmental delay struggle with sleep. And that might be because sleep is a feature of development. So we know that the ability to self-soothe is a developmental milestone. So if there are developmental delays, then that ability to self-soothe could also be delayed. So as mentioned with kids with autism, when optimizing sleep is accomplished, we can also see increased productivity, increased reaching of goals with services in our kids with developmental delay. Finally, let's talk about medical symptoms. So when struggling with physical discomfort, transitioning to sleep and back to sleep is challenging. The most common medical symptom that I see in my clinic in terms of kids that also struggle with sleep is pain. So when you're in pain, it's a signal to your brain that something's wrong. And so it's really hard to fall asleep and return to sleep if your brain is being signaled that something is wrong. So because of this, we really have to make sure that these patients are working really closely with their care team to optimize management of pain symptoms and do whatever is reasonable and possible to manage those symptoms so that we can see more sleep. When we see more sleep, so increasing total sleep time can improve sensitivity and experience of pain. And like we said before, if pain is worse, sleep is worse. So making sure that we're working on both pain and sleep is also warranted. In general, working on sleep while struggling with coexisting conditions is possible. Seeing success from behavioral interventions is possible. Just remember to work closely with your care team while going through these lessons. Thank you.